Dr. PK. She's a wonderful educator, mentor, partner. She's part of the Mahidol University Sirat Hospital faculty of medicine, and she specializes in infectious diseases. This is one of our oldest and strongest partnerships through UCLA and DGSOM and a global health program. I say the strongest because it's the most bidirectional. Lots of trainees are coming from there to UCLA for fellowships, for clinical rotations. You may see them on clinical rounds at some point in the spring of your MS2 or MS4 year. And then our students in their fourth year have the opportunity to go there. It's one of the most popular rotations for students. And part of the reason that it's popular is because of her and because of the infectious diseases rotation. The medicine infectious diseases rotation, extremely popular. Peds infectious diseases, traditional Thai medicine. They spend some time doing parasitology in a microbiology lab where they will actually see the data or the samples from patients that are currently in clinic, and you kind of see that connection between the lab and patient care, which is super exciting. She specializes. She also works in international relations for the Faculty of Medicine. So. Speaks wonderful English, does a really great job with that as well. And she specializes in drug-resistant bacteria, antimicrobial stewardship, also medical education. She's very passionate about teaching and mentoring. And she's recently actually mentored one of our MS2 students who got involved with her last year as an MS1, right where you are, in a really, a fairly small project that she could do during her MS1 year. And they just had dinner together last night. I'll let her tell you more about that. But I am super excited to welcome her, and I'm glad that so many of you are here to be able to see her speak today. So I'm going to pass the mic to her, Dr. PK.
Okay, good. Hi, everyone. Thank you for participating in this meeting. I have the first question for all of you medical students, right? Okay, now I'm handshaking and I feel dizzy. What is the diagnosis if I have the syncope right now? What is the first diagnosis you have to think about? Handshaking, dizzy. Yeah, because you all eat lunch, right? But I'm not yet. Thank you for that answer. So you got gift from me. Okay, this is from our SIID division. All right, thank you. So when you choose to be a doctor, you'll be a doctor all the time, right? All right. Okay, just make it like small talk. So my division is Division of Infectious Diseases and Tropical Medicine from Faculty of Medicine, Sirat Hospital, Mahidol University, Bangkok, Thailand. Okay, and it is not good. It's okay, whatever. So, actually, I like this one more. Okay. So, I can stand here. Everyone can see me, right? Okay. No, that's fine because I have to confirm myself. Okay. So, let me talk about my division for a little bit to be a background. If any of you would love to go to this project, you will see anything, you will be anywhere. Let's see. Our division was established since 1978. I am a doctor for 28 years for now. So, and this is the mission of our division. This is all the staff. We have 11 staff for now, but if you go to try the project in our hospital, you will have these 3 staff for your mentor, including the microbiologist mentor. So you have 4 mentors for one project. You exciting? Everyone is very nice and kind, including me. Okay. All right. The service, we have 10,000, 1,000 to 2,000 consultants per year, including the medicine department and non-medicine department. We have worked a lot about antimicrobial stewardship, and that is the main object for our research that I told you today. This is team of antimicrobial stewardship. Every day at 7:30, I will be at my ward with my fellow and teach all the team for how to use the antimicrobial for appropriateness. Okay, all right. Okay, you know that when we have infection, we need antibiotics, right? But in Thailand, it's different from here. The antibiotics can buy like over the counter without prescription. So we have many problems about drug-resistant gram-negative bacteria. Other than that, the only physician that can use appropriate antimicrobial is infectious diseases specialist. Other than that, they love meropenem. Whatever they put, meropenem. Even sometimes community setting UTI, meropenem. Yeah, something like that. So that's why it's very problematic and very important for this project. And this, we have our own laboratory outside that separate from the microbiology department of our faculty. So we can do both research and service by ourselves, okay? And that is a service. This is education. We have trained fellows since 2003. But for now, we have 7 fellows per year. For total, first year and second year, we have 14 fellows, including 1 more fellow from Lao publication country. And so you will be very fun. You will not alone if you go there. Okay. And we also had excellent standard of WFME 2022 already. And this is one of the educators. You can see Dr. Timchak here, right? Okay. Many of all of you participate in our country, our division here, and many of my fellow came here too. She's going to be a staff now, and we do overseas conference 2 or 3 times a year, especially when the COVID era. We still connection with this overseas conference. And this is how we can do more education for entire country. We have our own annually conference and also many workshops. For the research that is going to be go to you, we have many research that present like a World Authority Conference and also many publication every year. But we don't have just only service and education, we have work-life balance as well. We work hard, but we play hard as well. So any sport that you like, any party, we have party every month, every week, because everyone have birthday all the time. And we can go outside, you can ride the elephant if you want to, whatever. And we also have one of your faculty, Dr. Professor Joanna here. She went to our hospital teaching for a week, but she had 4-day work-life balance outside hospital. I didn't show you her picture of work, but I show you her picture of work-life balance. Sometimes we call work-life harmony, right? Okay, don't worry about that. So this is us. All right, this is background. I go to this thing, the new chapter of you, right? This is the first time. So the new chapter of discovery here, the new chapter, remember that it's not just for you, it's for me too. And don't be afraid about new chapter. It's not obstacle, it's always challenging. And many good things will happen when you challenge something for your life, okay? All right. We will do this project to serve you to get experience. We say that this is in vitro activity of any single hormonotherapy. and combination of antimicrobial. We will see that any regimen of the drug can fight with the XDR, extensively drug-resistant Pseudomonas aeruginosa, and we call it today XDRPA, okay? I already told you that this is the importance of how we have to do many antimicrobial stewardship and also testing the drug to fight with XDRPA because it has a lot, it causes a lot of hospital-acquired infection. This is the available antimicrobial that should have activity against PA, but you can see we have 15% for MDR or multi-drug resistant, and we also have 25% XDR patient. So if you have 100 patients infected by PA, you will lose 40, right? Think about it. And this is available anti-Pseudomonas in Thailand compared to in USA. And this is the data that why we have to do this research. Even you appropriate empirical antibiotics, it's gonna work only 37%. And from this 37%, you have good outcome only 60%. And that is not acceptable for the patient to get a good outcome. So because I show you limited antimicrobial treatment options and also high mortality in hospital patients. So we have this object of the research to test in vitro activity with mono or combination antimicrobial agents against XDRPA. This is going to be your study protocol. I know that young people love picture more than text, right? Okay. Mm-hmm.
That a medical student from UCLA could get involved with. They do a lot of different projects, a lot of different research, but this one is an example to just show you how a medical student could potentially, during discovery year, get involved with the work they're doing there.
All right, thank you so much. Sorry that I forgot. Yeah. Mm-hmm. Oh, okay. So this is the brief of the study protocol that you will have a chance to see and to do the extract the isolate of the organism from clinical specimen. And then you will test with broad microdilution for any agent that we would like to see the activity against Pseudomonas aeruginosa. And then we will see the MIC. The MIC, you know, is like the minimum, right, of the concentration of antibiotic that can kill the organism. And then we will do time Q assay to see in vitro against PA, okay? And this is all the drug that we will test. We will test all these drugs for monotherapy, and we will match some drug like let's say ceftazidime and fosfomycin that it's gonna be synergistic or not, okay? And this is the best slide for you. Someone that would like to join the discovery year, you will see that we will take 1 month for you to prepare proposal with a mentor from Siddharth site, and I think they will have a mentor from UCLA site as well. After we prepare all that proposal, we need 1 to 2 months to submit to the IRB or ethics committee to permit us to do the research. And this site is going to be for UCLA students. This 2 to 4 months, one student can do around here 4 months or 5 months or 6 months, and then come back to UCLA and start doing analysis, evaluation, and also write the manuscript. You don't have to be in Thailand all the time. You come back and we can work together. However, if there is more than one student interested in this project, we can have 2 to 3 medical students. And we can do this to 3 phases and 1 phase for 1 medical student. The first one come back here The second one go to Sirat and work the same thing. And because of that, you will practice about collaboration and communication skill and team-based skill. Okay. And this is your side that you will be arrangement. And this is our hospital. And this is the laboratory that you will spend time here like 60%. Other than that, you will see a clinical patient. In this lab, we can do service, academic, and research. So, in conclusion, strategy of you have 4 mentors from Sirira site for one project. However, you will be not alone. We have team of 5th-year medical students to be your buddy, especially on Saturday and Sunday. Maybe they choose not because of the project, but because of them. Okay, and each week, one of the mentor will bring you to see the patient because the patient didn't speak English. We will be with you. And Thai patient is very welcome, especially the doctor from another country. Please examine her or him. They are all kind and very welcome for all of you. Don't worry about that. And every week, we should have weekly reflection and feedback. And this is the way how to evaluate that you know every single thing and you can use all of the work and knowledge and anything that you get from there to use in the future. So that means reflection. And you will get the feedback from mentor. However, the mentor can get feedback from you as well. Okay. And this is Miss Ellis Gao. We talked via Zoom last year about this discovery year and small project. And she emailed to me that she would love to do something small project. And this is a case report of BCG septicemia in my cancer patient that are already present in Switzerland. And I have to prepare my manuscript. So I let her help to write the manuscript. And she worked very well. She's fantastic. And we discussion via Zoom like 4 or 5 times in that period, 6 months. This is the first time that we see each other in person last night. So thank you for that dinner preparation. So if anyone didn't do the discovery year, you can do small project with us as well. All of us had manuscript, right? Or even analysis of results of any project. Okay. If you don't want to go like for 4 to 3 to 6 months. All right. So I will stop now and I am happy to take any question or comment. Thank you.
Thank you for your talk, Dr. PK. Given that there's such a low barrier of access for antibiotics and the widespread nature of multi-resistant gram negatives, has your lab looked into using bacteriophage therapy as an alternative to antibiotics?
Pardon?
Has your lab looked into using bacteriophage therapy instead of antibiotics?
No.
Could you expand on why bacteriophage therapy is not a good option?
Pardon. Sorry.
I'm sorry.
Please clarify.
Why won't your lab consider bacteriophage therapy?
Why?
Why not?
I'm not sure that I understand you clearly. Dr. Tim Chek?
The question is, would you consider using bacteriophage therapy? Is anybody in Thailand using bacteriophage therapy?
I see. Thank you.
Yeah.
It's the same English word, right? Okay. Sorry about that. It's still in research. It's not in routine. So it's from any of our microbiologists. And I have read a little bit about bacteriophage, right? And it's not common in Thailand. No one uses it at all. For now, I mean.
Thank you.
Thank you for your patience.
Hi, thank you so much for your talk. I'm curious if your team has done research more in the social science realm as well, or participated maybe in activism efforts to improve the antibiotic stewardship program there?
Yeah, we did a lot of the research to improve the antimicrobial stewardship program, right? Many research had a good result, but the problem is when we did the research, everything is in control, right? After the research, then it's go back to normal life because the problem is to maintain. So now we try to do more and more about antimicrobial stewardship. And we train our pharmacists, maybe 30 of them, to help us to see that how is appropriate or not. And they have to call the ID specialist all the time to give permission to use the antibiotics. Is that the answer that you would look?
I think it gives me more to think about at least. I think I'm curious, what are the perhaps weaknesses in the current system that make it a lot more appealing for people to go and get their own antibiotics? Or what lowers the, I'm not sure how to formulate this. Or I think I'm more curious, what are ways that we can institute more long-term sustainable changes to antimicrobial stewardship? How can we incentivize that?
I see, thank you. Because the antimicrobial stewardship is not fight with the bacteria, it's fight with people, fight with physician that is not ID. The ID is only 11 people, right? So to maintain it, first we need data. When we show data that we can decrease the infection, how many percent? We can decrease the price of antibiotic, how many million baht, something like that. People will believe. But when that our physicians go out from the meeting room, they go to see their patient, fever, okay, ceftriaxone. 2 more days of ceftriaxone, fever is still there, meropenem. Because the knowledge is not maintained. So now we move antimicrobial stewardship back to first year medical student. And we try to move to our government to know more over the counter sell the drug. However, the pharmacists protest because that is the way to get income from the pharmacists. They had their own shop, something like that. Is that okay? So it's many of strategy, maybe 12 or 15 strategy to get antimicrobial stewardship done. Thank you for your question.
I have a pretty specific question on the meropenem. So I know it's IV only, or that's what we learned. So when they take meropenem, are they like, is it through IV?
I mean,
Like,
yes.
and this is over the counter as well?
Oh no, I mean that. Oh, okay. When it's great question. I skip that reason. When patient can buy the over-the-counter antibiotics, it's gonna be oral, right? Amoxicillin, ciprofloxacin, azithromycin, something like that, or even cephalosporin oral. When they eat it, it's acting to everyone microbiota. And the microbiota will develop the mutation to resist to group of the antibiotic, not just one antibiotics. Let's say if you buy ciprofloxacin and eat for diarrhea, it's gonna cause resistance to quinolone plus resistance to beta-lactam as well. Yeah. So, but when the patient comes to the hospital, everyone aware and afraid about, oh, is this patient had antibiotic in the community or not? And the patient looked very critical. So they put meropenem. And at that time, their microbiota like E. coli developed resistant to meropenem. So we don't have anything else to like treat this patient anymore. Right, thank you. That's a great question.
I'm getting my steps in.
Thank you, Dr. PK, for the presentation. My question was more about whether your data was collected all across Thailand or it was primarily just Bangkok. Because my idea was like, Bangkok is a well-known city, it's more developed compared to like southern regions like Phuket, for example. So I was wondering, do you see like the misuse of antibiotics, is it like similar across Thailand?
Okay, thank you. Have you been in Thailand before?
Yes.
Okay, that's why you know. Because in Bangkok, many people, many university hospital, many drugstore. So that cause more resistance than in another province. But now entire country getting up about resistant, but not the same percent or same rate. It's going to be very high like this in all university hospital or even large hospital in any province. But thank you for that question. This is percent of the isolate just in Sirirat Hospital. But if anyone would love to see entire country, you can go to NARST, NARST, that provide from the government to see entire picture of the country. You can go to that NARST too. Thank you.
Thank you.
Any other questions? All right. I think if you don't have any other questions, she's going to be here for a few minutes. I know you have to leave to class soon, but if anyone has any specific individual questions, you can come up for the next couple minutes and we will see you all next week, I think.
And anyone that have a question with me, please take something here. We have pen and bag, and I think more than the number of someone that had question, but not enough for everyone. And thank you so much. Oh, sorry. I couldn't.
Yeah.
What's that? I got you. Thank you. Get some lunch. It's vegetarian.